Well, thank you very much. I'll try not to be too nervous. I can teach 220-year-olds second-year university statistics, and I'd rather be doing that. But no, it's great to be here. Thank you to the Coal Mine and to Pauline and to the European Federation for allowing me to speak to you today. It's been wonderful, absolutely wonderful. I went home yesterday evening on a high. I was tired, but I was on a high. And about a month ago, I actually visited Coal Mine and the Women's Centre, and I went home from that on a high and thought, oh, you know, I'm going to bring these principles into my home. I'm going to do this. And I have 4 adult children living at home from the ages of 15, 19, 22 and 24. And 2 of them were at the Red Hot Chili Peppers last night, and I was about to get into bed at 5 to 12 last night, and I get a phone call saying, would you pick us up? I could kill them. So I think, you know, being a therapeutic community is, as we heard this morning, it's very hard. It's really hard, and you know, it's a wonderful thing, and I heard all these wonderful things yesterday, but it is actually really, really hard. So I have an appreciation of that. Pauline asked me to give you a little bit of a speech about some of the prevalence work that I'm involved in. And so I'm going to give you sort of a bit of the bigger picture around Europe and a little bit in Ireland. And then I'm going to go right down and go to very, very small level to one area of Ireland that I've been working with. And one of our speakers this morning said something about doing research that is meaningful and makes an impact. And even though I have training in mathematics and biostatistics, working on HIV and AIDS years ago, actually what drives me is to make an impact and to use my skills. I'm not a practitioner, but if I can use my skills to make an impact, that really, you know, is rewarding work, and I hope give back something. So I'll start at the big picture, and then I'll bring you down to a project in a very small area where I hope we're making an impact. So I'll start, as I say, with the big picture. So that's just basically what I just said, to provide an overview of the prevalence of women using substances. I'll give you some European statistics from the EMCDA. We actually also then did a bit of a literature review on parenting interventions, and we heard the great work, and we're going to hear Johanna about her work on the Parenting Under Pressure programme. And I did some work on reviewing those. Then I'm going to go down to the community level, because, I mean, you know, we live in communities, whether it's my community and my family at home, or, you know, in our local communities, and a piece of work that I'm just completing at the moment in a community. And then I'm going to talk about how we got that into a strategy. So it's really right up from the big picture and the policy and these European institutions right down to the individual level, and try and connect in across those levels. So I'll try again. So here's just some slides that the EMCDA were kind enough to provide me with, is that the prevalence of cannabis use, if we're looking at prevalence, is actually the most commonly used drug across Europe. And you can see there the different prevalence rates just geographically, and 17% of those entering treatment are women. So there's over 88 million people across Europe who've tried cannabis. 1% of adults are actually daily users, and there are sort of diversity, as you can see from the map, in trends. But 17% of those entering treatment are women. Heroin, then, if you go to the other end of the scale, high-risk opiate users, again, heroin is still dominating across Europe. There's, across Europe, at the moment, 1.3 million high-risk opiate users. That's a lot of people who need help. And I think if you look on the right-hand side there, it links back to some of the work that we saw yesterday evening. There's just a few of us there. A lady called Anne-Marie Carew was talking about ageing and the opiate epidemic, and how now that, you know, this is a whole new area. I know in the States they've had that, but this pattern now of those that are ageing who started maybe using heroin when they were younger, but actually late onset. So older people who are starting to use heroin, who may be through prescription opiates for chronic pain or whatever. And also what we're seeing across Europe, and with a paper coming out on this in the Irish context, is this idea of the age entering treatment. I remember when I first worked with the EMCDA, a long time ago, back in the late 90s, the Irish population was very young, and we had a 2-year time period before people who were using opiates entered treatment. The average now is 7 years before entering treatment, and the average age in treatment is older. So even though we have a high birth rate, we are also an ageing population, and that's actually being seen across Europe. And that is going to have consequences for the wider health services as people age and they experience those chronic health conditions in addition to their substance use. In terms of opiate use, there's 1.4 million people across Europe in treatment. These are big problems. This is 1.4 million people in treatment. 20% of those are women across Europe. And again, you can see just the distribution of the different types of treatment across Europe there. Yeah, the new synthetic drugs and new synthetic opioids, they're a huge problem. On the EMCDA, we do risk assessments when they're called for by Interpol and the European Union, and the amount of risk assessments we've had to do for new drugs has just exponentially exploded. So I've seen these sort of case studies and seen the statistics and the case studies of the impact. It's shocking because, as I say, I have 4 young adults in my house, so part of being a professor, I'm also a mother, and I'm aware of what goes on in society. This is just a different level of danger and of harm for our populations and our young people as well. Overdose deaths, again, there's been a rise in those for the 3rd year, and 22% of those are women. So there were over 8,000 deaths in 2015, so you're talking about 2,000 women, over 6,000 men dying from overdose in 2015 across Europe. And you see the trends there are increasing. Some of those trends are because of better reporting, because we know that in Ireland we're really making great effort to improve our reporting, and that goes down to the great work going on at the Health Research Board and at the National Focal Point. They're doing great work there, and with the services around the country providing the data, that's really, giving us the evidence across Europe and in Ireland. In terms of just our students, this is just a comparison again in terms of alcohol use with our European students and our US students. You can see there that Europe alcohol continues to be a major problem in terms of our students, in terms of tobacco as well, and cannabis. The States will be higher than us in terms of our students. This is just, I don't know if you can actually see this, but the National Advisory Committee on Drugs and Alcohol, they do a general population survey. It's our general indicator of prevalence of drug use in the population, and it's done all across Europe as well. It's again one of these European indicators, and you can just see that in terms of last year prevalence of any illegal drug. If you take a look at just young women, 12% of young women ages 15 to 24 there have used an illegal drug in the last year, and nearly 7% of women, say 25 to 34. And these are sort of the years that women are having children as well. So that's the prevalence in the general population. That's just through household surveys. Obviously, it probably is higher than that. This is something we know nothing about. It's what we call the hidden harm, and there was great talk this morning, in the prisons about children out of prison. But one comment I didn't add this morning was that, in actual fact, in Ireland, we have refocused, we've had new emphasis on children. We have a Department of Children and Youth Affairs. We have a children's strategy, Better Outcomes, Brighter Futures. We are focusing on our children, and that because we have been shamed. We have been shamed with the abuse of our children, but that is something as a country that we are addressing. And I know, Joanne would have a particular interest in the homeless and homeless children, but we are addressing our children. But one thing we have not done is estimate the prevalence of the number of children who are living with substance use. We will have some estimates coming out. National Advisory Committee on Drugs and Alcohol have commissioned some estimates, and they're due to be published. And this is that hidden harm of the children whose parents are using substances. And I mean, you in your practices are aware of this. They are what we call the hidden harm. I've done some local work on this in a couple of task forces. There are sort of areas that are sort of geographical areas that are broken down for administrative purposes, and we found in one of my local studies that for every person known to treatment services, there's just under one child. The exact ratio is 1 to 0.88, so it's just under one child. So if we know that we have about 20,000 opiate users, people who use opiates in Ireland, I can tell you that there's just under 20,000 children. So that's just in the opiates. Nobody's actually counted that yet, but as I say, on a small area we've done some multi-source enumeration, and we've actually estimated this, and again a publication coming out on that. But this is a hidden problem. So that's the big picture. So given all of that, I was asked by one of these task forces to look at risk and protective factors for women and children, because they wanted to make a difference and they wanted to do something in their area. So this is the context within which this local area asked me to do some work. So they said, look, will you do a literature review and see what are the, and this is an area outside of Dublin, so they wouldn't have the same level of services that would be available in Dublin. Will you do a literature review and see what are the sort of programmes that are out there? We said we'd also, let's do a consultation with the service providers in the region, both the drug services and the children's services. And let's speak to parents. Let's speak to parents, parents who use drugs, and see, well, what do they think are the risk and protective factors for their children, and what are their needs? Let's speak to the mothers and the fathers. And let's speak to other family members, because going back to this idea of community, we find that it's the grandmothers, or it could be the sister or the aunt or whatever. Let's speak to the people who are actually, as not just the parents, but who are maybe minding the children as well. Let's speak to those other people as well. So in this area, we had great buy-in from the local services. They were so facilitative, and the people from that region enabled us to do this research, and it was very, very powerful research. And again, now we've come from this big European level down to right in local communities, going in, sitting on the chair, talking to the women, right, in one out there by that treatment centre, one in there in this sort of local area. So we have so much data that actually arose from it, and I'm a quantitative person, but I work with qualitative researchers as well, and I've learned the skills to try and do this research, because it's so powerful. Like, I love the science behind the numbers, because politicians, they love the numbers, but then we have to have the real life stories, the real voices. Let's hear what it actually is like on the ground from the people, and we use both our quantitative statistics and our real life stories and the lived experiences of these people to tell us, what do you want, how do you see the risk and protective factors. So just from the literature review, I won't go into specific programmes, but the features of the programmes that we found that worked was that the whole family approach is absolutely important. The multi-agency. It's not just one agency can take this on their own. And what was great about the study that I did was that actually it was the drug agencies and the children's services agencies that came together to commission the piece of work. And, there's a willingness there. But of course they are overwhelmed with work. Both the parents and the children should be involved. Interesting, one unforeseen finding was actually the strengthening of relationships between agencies. So not just the parenting programs themselves, but in actual fact, by working together, this actually enriched the agencies. The trusting relationship was really important, and interventions need to be delivered by professionals who have the experience. So that was what the literature, when we did a systematic literature review, they were some of the key features of what's important. And those findings, it's funny, we did the literature review first, and then we went out and we did the consultation and the interviews with the parents and the grandparents and the service providers. And actually the same sort of results came up. Like, the people know what they want. So this, I'm not going into the detail here, I'm just highlighting some of the words and themes that came out. But I suppose one of the advantages of being a speaker on a Friday afternoon is that you've had the benefit of hearing all of the other talks. And yesterday, we heard the talks from, was it Gera, talking about, intergenerational use of substances. We talked about trauma. We heard about the prisons. And everything, that I see now in my talk, actually I heard already in the talks. And these things, these are joining up the dots, that this is actually, I suppose, we're reinforcing the message. So the themes that came up was the intergenerational addiction, the homelessness. It's a huge problem. I mean, even when I was out in Coolmine visiting, I overheard a conversation about, well, you know, in terms of step down, where are the people, when they leave here, going to go and live? You know, if we're dealing with the addiction of putting in these resources, where are the people going to live afterwards? We have a huge problem with homelessness, the domestic violence, the children in care. These were the risks that the parents identified. They weren't aware of what services were. They had anxiety about engaging, huge fear over losing their children. I mean, I spoke to some women, and you know, really only when you maybe sometimes turn the tape recorder off that you get the real stories. I mean, I've spoken to a woman, and she just, you know, her lack of anxiety, I mean, she wouldn't ring the school. This was a middle-class, educated woman who was dealing with alcohol use, and she was ashamed to ring her children's school because she didn't feel that, you know, that it was her right to ring her children's school to find out how her children, her 3 children, how they're getting on. That's her fear. Just in terms of the feeling isolation, the problems with mental health, which we heard Eamon Keenan talking about yesterday. So the women can articulate, they articulated their challenges, what they see as the risks and how they're feeling. These are some of the results. This was really powerful, was the grandparent focus groups. To have grandparents sitting around and to see the pain that those people, I'm a parent, you know, so I know them. I mean, I have a son of 24. He may as well be 4. You know, I'm still the same parent. He is still, well, some days, you know, God. But I'm still a parent. So whether I'm a grandparent or a parent, or whether he's 4 or he's 40, I feel the same. And for those grandparents, the power in their words. One grandparent saying to me, you know, when I'm listening to the radio and I hear that, you know, there's been an armed raid or an incident, you know, in the town, she says, I'm thinking, oh my God, is that my son? And then she says, I'm almost hoping it's my son so that he'll be taken in and he'll be cared for. You know, this is what these people are going through. These people in their 60s who should have their lives back, who should be in their golden years, are caring for children. It's you know, the resilience. And the resilience in the parents was phenomenal. The resilience is just never ceases to amaze me when they've been through these traumas. Maybe it's because I'm a researcher, maybe you all know this, but as a researcher, to me, this is just, I've learned so much through my work, because I'm not a practitioner, but to hear this resilience and the people who've been through these traumas. The grandparents spoke about the fragility of recovery, about people needing to be supported, about the dual diagnosis. They're talking about the need, they're worried about their grandchildren. They're worried about the grandchildren, you know, maybe becoming involved. They wanted interagency work. They're trying to drag the child, you know, dropping the child off school and then go to this service and then go to that service, and the need for the interagency work. And I know, Johanna, you're doing on a pilot sub-project on interagency work. It's really, really good work. And just to hear what the grandparents have to say. It's, you know, then when we spoke with the service providers, we did all the services that were involved in the region. We did a survey with them, and it was kind of like a word survey to, you know, get their risks and protective factors and what was needed from their point of view. And then we did some interviews as well. And these again with what they saw as the risks, again just you know, challenges to parenting, risk of abuse, the neglect, attachment. And we heard attachment yesterday mention the importance of attachment when they were speaking about the women in prison and the importance of the attachment. The protectors, and look what comes right up, these are word clouds. The big thing, when we talk about the grandparents, there's family. You know, whether it's a sister or a grandparent or an aunt or a brother, the importance of family and family community as a protector for the children and the persons who use drugs, and just social supports as well. Finally, some of the enablers from the service providers. What will help these services? You know, the service providers are all on board, but they're overwhelmed as well. I mean, you could just see that in their work. This sort of idea of a common assessment, because the drug services and the children's services don't have the common assessment. The interagency working, they recognise that these were things that would make them do their job better and provide better service for their clients. I liked this one because it was just some of the other items that we picked up, and being, of course, trained in mathematics and statistics. Look at that lovely data word there. The data is so important. You know, I know we have to hear the people's voices, but like we saw there at the big European level, to have the data to inform policy, to make the argument for policy. I am now in the very fortunate position of being on what I call the inside, because having spent years and years and years on the outside, I know the value of being on the inside, being able to speak to policymakers, being able to be at the table. So to have the data and the statistics, and then to enrich that with the powerful stories of the people who are actually experiencing this is really important. So I was really glad to see that this actually came up. I was really pleased with that. But I suppose in terms of the next steps then in this particular area, what we did then is we brought all these results back to them, and we said, look, these are your results, they're not my results. How do we then bring that into some sort of a strategic plan for you? And what came up were the sort of three themes: the children, the parents and families, and the services and the systems. And again, trying to take the strengths-based approach, not say, you know, let's not talk about, it's too big a challenge for somebody to say, we're going to decrease drug use in this area. You know, that's a really hard thing to do. Let's talk about improving, you know, the protection for the children. Let's talk about improving parent effectiveness. Let's talk about increasing collaboration. Let's change this into a positive. So we made our strategic planner, they made their strategic plan on a positive, to improve, not talk about reducing. And by improving, obviously you will reduce. Yeah, I don't think you'll be able to see this, but they then said, we had a workshop with the service users, with the service providers, with the grandparents. They came to a hotel. We spent a day in the hotel, and we got them to prioritise their actions. And this is the priorities. Number one was to roll out some parenting programs for parents and children, to work with the children, to provide input for the services and systems. And these priorities were not my priorities. This was actually the local community organised a big day in a hotel, and we went through and we had roundtable discussions, and we got from their data and their words, and when I gave them back the results and we looked at it, they then set a priority. Great work. It's not finished. And this actually now, we're at a hard point now. We heard this morning about fidelity. We heard this morning about the challenges of implementation. They have their strategic plan now. We've had the summer. In September, you know, a little bit of impetus could be lost. So I'm due to go back to that region this month or next month. Again, it was pushed out to next month, and to look now at how are we going to actually implement this strategic plan, their strategic plan. And that's a huge challenge. Like we heard about it, you know, implementing the therapeutic community within the prisons. You know, if it's not done right, if you've got a half a therapeutic community, it's going to fail, and then you're going to get a bad press. This has got to be done. I've been really working in implementation science to try and improve how things are, where are the gaps, and leadership is so important in implementation science. So I've been working, and I'm hoping to work with the community down there and work on implementing this very much a local strategic plan, but informed by those bigger needs. So that's me. I'm Catherine Comiskey, and thank you very much.